Hello and good afternoon, everybody on the line. Thank you for joining us. My name is Mariah Blake. I'm the staff assistant here at the Association of Clinicians for the Underserved. I also work very closely with the STAR Center, which is the group that is bringing you this webinar this afternoon. If you've joined us before, welcome back. If you haven't, welcome to your first webinar. All of the webinar materials will be made available on our website. The information will be coming up in a second at chcworkforce.org. If you have any questions about this webinar during our presentation, don't hesitate to drop them in the chat box or the questions box, raise your hand, shoot me an email. My information is on the screen right now and in the chat box as well. We are recording this webinar. That'll be uploaded through our YouTube channel and to our website in the next day or so. You all will receive a follow-up email with the link to that so you can access it. At this time, we have a copy of the slides and a general information flyer in the handout section of your control. Feel free to download those now, or we'll make those available on our site as well. Feel free, again, to ask questions during the presentation. If I can manage it during the presentation, I will. If not, we'll hold on to it for a more live question and answer section towards the end of our presentation here. Most importantly, have fun, stay relaxed, and I hope you enjoy learning about our self-assessment tool. All right, and here is our presenter, Paddy Dipadova. She works very closely with us here at the STAR Center, and she is the person you have to thank for this great tool. So I'm going to hand it over to Paddy.
Hi, again, this is Paddy Dipadova, and just before we start taking a look at the tool, I just wanted to give you a little bit of background on it. When the STAR Squared Center got started, one of the first things we did was do a great deal of research into provider recruitment and retention and the most current methods to improve recruitment and retention, the problems that people have with recruitment and retention. And we pulled all of that together, and our first project was to come up with this assessment tool to might as well start with this part, to come up with the assessment tool to help health centers identify some of the things within their own health center that they might be able to improve on to have a better success with recruitment and retention. So the self-assessment tool that I'm going to be walking through is available at the chcworkforce.org website under this URL, ACU-self-assessment-tool. Just a little background on how the information is used. We're hoping that primarily the information is for your own use. It will help you identify some topics for further exploration. You'll get an email, which I'll show you a sample of. When you complete the assessment, you'll get an email fairly shortly after that will give you a brief summary of some recommendations that have been identified that are customized to the responses you made on the assessment. And the data also informs the health center needs. I'll talk about this a little bit more, but so that we can try to target resources and trainings to the things that we're seeing on the assessments that people have concerns with or gaps that we're seeing. And also, what we hope will happen is you'll use the assessment tool and you may find an area that you'd like to work on a little more. And if you feel like you'd like some assistance with that, the STAR Center is there to assist you in terms of individual technical assistance or training. And we would have access to the baseline information on your assessment tool while we're talking to you. So you wouldn't have to kind of repeat everything over again, and we could do a little bit of analysis with you on the phone or by email. In addition, the STAR Center has a huge number of resources available on all of the topics that we're going to be covering in the self-assessment tool. and the URL for that is shown. It's also on the chcworkforce.org website. So we're hoping you'll use all these resources. One note is we do keep this information confidential. The STAR Center keeps it confidential, and any consultants that they may match you with for technical assistance would also keep your information confidential. We do use aggregate data for training development, quality improvement initiatives, and progress reports for our funders, but we do not use any individually identifiable data in that aggregate data. So your confidentiality is secure. The tool has 32 questions, and it takes about 20 to 30 minutes to complete. Again, we would suggest that you use it to identify strategies to improve provider recruitment and retention, and you'll get a brief recommendation on topics of interest based on your responses. Then again, we're also available to assist you once you've done that. When you sit down to complete the tool or the assessment, you may want to have more than one person available to complete it. If you want to use accurate information, for example, we ask about the FTEs or full-time equivalents of the types of providers that you have and things like that. And you may or may not have all of those answers, so you might want more than one person. However, you can provide estimates. The tool is for your own information. We don't ever aggregate the data to say, you know, this is how many FTEs health centers have or any of that. That's all done on the UDS already, so we're not trying to recreate any of this. And the number of self-assessments we get clearly aren't a survey that we could ever use, because they're people who have self-selected to do the self-assessment. So we don't use the data in that way at all. So feel free to provide estimates. But if you would like it to be more accurate for your own use, you may want more than one person on your team completing it. So this is what the tool looks like. I'm not going to go through this a lot because we just did on the prior slide, but it gives an overview how to use the tool, the uses of the tool, the data that comes from it. Again, information on how to get in touch with the folks at the STAR Center, and confidentiality. And the initial part of the tool is demographic information, so we know how to contact you. Anything with a red star is required to move on with the tool. So we would want to at least have your name, email, phone number, your organization, city, and state, because we may want to reach out to you and say, oops, you know, there was a mistake on the tool or something. Or if you contact us, we want to be able to match you up as the person requesting for training or technical assistance with the information you've completed on the tool. So the most important thing, I think, on this sheet from me, on this part of the form, is to make sure the organization name is the name of your health center. So health centers may have several sites. So if you're using a self-assessment tool for one or more sites, but not all of the sites, we really would want the organization name to be the health center, not just the site. And then on the next page, we ask you what your concerns are if they're not with just the whole organization. If it's the whole organization, enter all sites. If it's not, enter as many sites as you like. It's a text box, so we can see all the sites that you're concerned with. Then we would like to know what kind of health center you are. And the other box is there because although the STAR Center was set up to assist health centers, this information is available to anybody who wants to get on the website. So if you are not a health center, just click Other, and you can still use the assessment form and the resources. It's just technical assistance and training may not be available to you. But it is available to health centers. So we also ask whether or not you've completed the assessment before. one reason is you may complete it now, and then 6 months from now you may do it again. And we'd like to know to look for more than one assessment so that we can see the progress. Under provider information, again, we're asking for the sites again. This may seem redundant, but in this case, you may have said 3 sites before that you were concerned about, but maybe you only have the data for 1 site for the provider information. So we'd like you to tell us in this cell, for the rest of the assessment, what data are you giving us? So to be sure, because we do a lot of, we do some ratios and do some things with the data to help assess what your needs are. So be sure from this point on you've used the same site or a group of sites in all the data. So don't provide providers for 1 site and then give us support staff for 3 sites. Because we're trying to, there's a little math going on in the background on the form, so we want to make sure it's consistent. So this is the table for the provider information, and we'll see the specialty down, listed down on the left, and then the columns going across the top. The first one is the full-time equivalent of employed providers, and lines 1 through 5 refer to physicians. If you have a nurse practitioner, for example, who's a pediatric nurse practitioner, please don't put that person in line 1. Put that person in line 6. This is very similar to the UPS, so the definitions are anyway. And then for B, we want to know how many full-time equivalents you have of contracted providers, so not those that you employ. C is the number of FTEs of vacancies you have. So when you look at A, it says currently employed. We don't want to know how many you have budgeted there. So if you normally have 3.0 pediatric physicians, but you have a vacancy right now, in column A, you would put 2.0 for the ones that are currently employed, and you'd put 1.0 for the vacancy, just so we can calculate the accurate percentage of vacancy that you have. And then in column D, that's the calculation. Column E, we'd like to know how many months you've had that vacancy. If you have more than 1 vacancy, then give us the total number of months. So if you've had 2 vacancies of 12 months each, put 24 months in there. And that gives us a kind of the depth of what your vacancy issues are, your recruitment issues. And then the last column is the calculation. For those health centers who do deliveries with family practitioners or non-physician providers such as certified nurse midwives, we would like to have that information. So if you can just say yes or no here. And this area is to give us some idea of the age of your providers in terms of retirement and succession planning. So we categorize physicians and dentists together and non-physician providers in another category. If you can just give us, this gives a, I can't scroll on here because it's not a live screen, but it gives you a rough percentage, like what percentage of your physicians and dentists are under 50, and it's a scroll down you can choose. This question is pretty clear. You can only select one, and there's just a range of for strategic planning. It's basically that you haven't conducted any strategic planning is A, and D is that you have a much higher level of strategic planning, you define objectives, and it's included as part of your overall strategic plan for your organization. For practice infrastructure, we are looking here for things that can be a strain on providers. So, for example, if they're on call very frequently, we are trying to get some idea of that. So for number 5, we'd like you to give us the number of on-call days per month per provider. Now, everybody does call differently, so you'll need to just figure out what that average is. You may have a provider that's on call once a week, so your average would probably be 4 or 4.2 if you're counting that there's about 4.2 weeks a month. You may have a provider that's only on call once every 3 months or once every 4 months. So you put in what the average is per month, so 0.33 or 0.25, just to be consistent so we can compare across provider groups. We'd like that for physicians and non-physician providers. We don't include dentists here because we're not really looking at call for dentists for this particular issue. And then for number 6, you can indicate how many sites your providers typically work in an average month. So again, for physicians and non-physician providers. And then do they cover regular office hours for evenings and weekends? This one could be a positive and a negative. It could mean that you're giving them flexible hours, but it could also mean that it's a strain on providers to have those extended hours. So just something that's a good data point to have. So number 8, we are going to calculate in the right-hand box what your clinical support staff is per provider FTE. So you just fill in the left-hand box. So we only want the FTE of all your clinical support staff. We don't want you to figure out the ratio. We'll do that. And we'll go back and use that table under question 1. So that's where I was mentioning before. You need to make sure the support staff that you're noting in question 8 are for the same site that the providers are for question 1. We're only looking at clinical support staff, so we're not looking at your administrative staff, your billing staff, reception staff. We're looking, this would be more similar again to UDS definitions if you want to go by that, or again, it's estimated. So if some people are checking people in half the time and a medical assistant the other half, just you can estimate the amount that the clinical support staff FTE is by dividing that up. The next couple of questions are about whether you panel patients. So number 9 is whether you assign them to an individual patient panel, individual provider patient panel. Number 10 is looking at team panels. So you could answer yes to both of these if you have team panels, or yes to only one, depending on how you're set up. So number 11 is just pretty straightforward, is whether or not you have an electronic health record. The next few questions are about a recruitment plan. 13 is asking whether you continually recruit. So you're always looking for somebody, whether you have a vacancy or not. 14 is whether you have a written recruitment plan. A lot of people have recruitment plans because they talk about them in strategic planning meetings and they talk about them at staff meetings, but they may not have ever written them down. So we're specifically looking for something written. And 15 is just asking whether the community plays a role in your recruitment plan, and that can be very broadly defined. It could be other primary care practices in the area who may also be recruiting, and are you talking to each other? It could be the hospital. It could be community members, getting feedback from them on what types of providers they feel like they need. So, and again, we're talking about including them in the recruitment plan and also in the written recruitment plan. So 16 is asking if you do have a written recruitment plan to check off those components that apply that are in your plan. Retention plan, similar. Do you have a written retention plan? It could be part of your recruitment plan. Typically, they would be in the same document. Would make sense because there's a lot of overlap. And does your health center conduct provider satisfaction surveys? So that would be something considered part of the retention plan, seeing if your provider staff are satisfied and finding out if they're not, why. So this is looking at your frequency. And then 19 is, you could use, if you have provider satisfaction surveys, you could use data from those. But 19 can just be your opinion or your team's opinion of what are some of the problems and issues that providers in your center face. So it's just kind of acknowledging that, okay, yeah, in our town, we don't have a lot of availability of quality housing, for example. And there may be things that you can control and things that you can't, but you should be aware of all of potential issues. So checking off all that apply on this question. This section is to discuss leadership a little bit. Number 20 is for executive leaders. And again, it's kind of starting from the top with short-term only business priorities down to the fourth one where there's, support continuous learning throughout the organization, review and act upon quality data, and have a long-term strategy and funding commitment to explore, implement, and spread quality improvement initiatives. So it's a range there, or that you just don't know. So with clinical leaders, again, a range, intermittently focus on improving quality all the way down to consistently championing quality. And the last one on this page is the organization's hiring and training processes. And again, you can, for this one, you can check all that apply and just some characteristics of how you hire and train. For provider compensation benefits, we're looking at what your compensation model is. So there can be incentives and a straight salary. So this one you can check all that apply. This one's kind of in an odd order, we should probably correct this, sorry about that. But straight salary can also be a base salary. So you could pay providers just on a straight salary, but you could also pay them a straight salary with some incentives. Other options are just paying them based on incentives. So you can choose all that apply. The incentives that we've listed are for production, which would be for how much money they bring in or revenue, the number of visits they generate, or it could be on another system such as relative value units, whatever system you use. If it's based on how many patients they see or some other indicator related to how many patients they see. There could also be incentives for quality, patient satisfaction, or incentives for internal administrative task completion, so things like signing all their medical records, attending administrative meetings, those types of things that you may determine internally that you want to incentivize. Our year-end bonus or one-time bonus, whether it's year-end or not, or other, you may have other models that you use or other components of the model. Again, we'd like to see it by physician dentist category and non-physician provider category. We do see often there's a big difference between these two compensation categories in how people are paid. We'd also like to know when you last reviewed your provider compensation model. This is not a required field because you may not know. So if you do know, that would be a good date to keep track of. Other parts of compensation is just a list of potential benefits that you may have. Again, we'd like to see them by physician dentist or non-physician provider categories. In addition to the typical benefits that were on the prior page, you may also offer standard benefits like moving expenses, helping providers find a home, helping them find child care, helping their partner find a job, and there may be other moving assistance provided or no assistance. We'd also like to know a little bit about your provider schedules. Do you offer part-time positions, or are they all full-time, or do you also allow people to job share? Do you have flexible provider schedules? And then the other alternative is neither part-time or flexible provider schedules. We're coming towards the end where we're just looking for what other strategies you may be using, or to kind of give you a tickler for what strategies maybe you should be using if you're not already. The first is patient-centered medical home, whether or not you're recognized, whether you participate in the National Health Service Corps loan repayment program or a state loan repayment program. Not every state has a loan repayment program, so that's an option to say that it's not available in your state. Participation in your state's J1 visa waiver program, or if you have a relationship with a provider residency program. At that point, you'll see the screen. You'll be able to click Submit Form and Send. And then I'm just going to get out of this for a minute. This is a sample of an email that you might receive back. You'll get it very quickly, within a few minutes. And it just kind of goes down through each of the categories. So for this one, family practice physicians, there's no recommendation based on the time. Based on your response, there are family practice physicians on staff. These two are looked at in terms of making sure you have a non-physician, or you've considered and have hired non-physician providers, that you have family practice providers, that you're looking at succession planning. Then if there's something, you don't have a recruitment plan, you may get a message similar to this, the reasons why you might need one. Anyway, and it goes down through all of the components to give you information. And then at the bottom, gives you the information for how to access our website and how to get a hold of the STAR Center for technical assistance or more questions or training. And again, for each of these categories on here, there are resources available on the website. So again, to follow up on the recommendations from the email, you should start with accessing the STAR Center Resource Library, calling or emailing to get information on training. There's also information on trainings on the website, or requesting technical assistance. And when you request technical assistance, just to reiterate, they will have all this information, your self-assessment available to talk to you. Here's the information on the chcworkforce.org. And just, I don't think I've said this yet, but most resources and services are free for health centers and a QAC lookalike. So this is all being funded by HRSA. So it is free to health centers and QAC lookalike. So I'm going to pause for a moment now and see if there are any questions.
All right, thank you for that presentation, Patty. While we're waiting for some questions to come in, because I know that was a lot of information, just want to reiterate that all of the resources and training assistance that Patty referenced in her presentation here, they are available on our website at chcworkforce.org for free. You can go into our resource center, check out our resource bundles, or they're sorted by different content type, topic type, whatever suits your need based on some of the recommendations from the self-assessment tool. Going into the fall training session here, I know that we look to the self-assessment responses for registered attendees for the trainings that we host with PCAs. We take a look at those self-assessment tool submissions and see what all it looks like you guys could want to talk about or learn a little bit more about in our trainings. So your submissions help us to help you to create more resources and better trainings in the future. Don't see too many questions coming in at this time, so I'm just to let you all know that in 2 weeks, I guess that is, on September 28th, we will be hosting an office hour, a virtual office hour, to answer questions, comments, concerns about the self-assessment tool as you use it either just for your daily or weekly, monthly workforce prep with your organization or as you prepare to attend one of our fall trainings. I will drop the link into the chat box now if you would all like to access that. Just let us know that you're interested in coming. Otherwise, we'll hope to see you online on the 28th. All that information is also on our training calendar on the Star Center Workforce website. Doesn't look like we have any questions now. I hope that you all take some time in the next coming days here to take the slides or the recording of this webinar and walk through the self-assessment tool with your workforce team. And be sure to let us know here at the Star Center if we can do anything to help you, to help you with some training, technical assistance, or just general resource creation. All right, Patty, do you have any wrapping up thoughts here?
No, I thank everyone for attending. Please contact us if you have any questions or need any assistance. We'd be happy to help. We do have more tools in production as well that we're not going over right now, but it's definitely worth taking a look at the website to see some of the other tools that are up there.
All right. Yeah, please head on over to our website, check out some of those tools, sign up for our newsletter so that you can be one of the first people to find out about our upcoming trainings or resource launches that we have in the works. And just let us know what we can do for you. Thank you all for joining us this afternoon. We'll talk to you soon. Bye-bye.
Bye.